Hello, and thank you for joining us for our Facebook Live Q&A discussion. We're joined today by Dr. Brian Woods, a fellowship-trained non-operative sports medicine physician with orthopedics and sports medicine by BayCare Clinic. He's here today to discuss regenerative medicine, what it is, how it can help patients, and answer any questions that you might have. Thanks for talking with us today, Dr. Woods.
Thanks for having me.
Before we get started, I want to ensure everyone that we are being safe today. We're joining from our own separate locations. We're hoping that all of you watching are taking precautions as well in the wake of the pandemic. Another reminder, we know many of you watching will have questions about regenerative medicine or what treatment options are available at BayCare Clinic. We've already incorporated some of those questions into our plan for today, but if you have additional questions, please feel free to ask Dr. Woods directly in the comments. We'll do our best to answer those questions today in real time. If we do run out of time, don't worry, we'll also respond to those questions shortly after the live broadcast. But please go ahead and do that. He's here to answer your questions today, and we're gonna go ahead and get started.
Great.
So, Dr. Woods, let's just start basically by telling everyone what regenerative medicine is. Another term that they maybe have heard is orthobiologics. When people hear those terms, what exactly is that?
Yeah, great question. So this is an exciting new area of medicine, and basically the term regenerative medicine, or as I prefer, orthopedic biologics, really revolves around the idea of using biologic therapies to treat a variety of orthopedic conditions. And the goals of these treatments are really to improve pain and function, and in some cases initiate a repair response depending on the condition that we're treating.
Yeah, and you just discussed it a little bit, but talk a little bit about maybe what this is designed to do for patients who take advantage of these procedures.
Again, function is the goal here. So everybody has some activity they want to return to, whether that's work or play. And so after suffering an orthopedic injury, we do understand that there can be a lag time between returning to that. So these therapies are a non-operative, minimally invasive means or way to try to get people back to their activity. There's a variety of options that we can offer depending on what we're treating.
Yeah, so let's talk about some of those different options. Obviously, there's different types of regenerative medicine treatments. Can you talk a little bit about maybe some of the ones that people have heard about and the ones specifically that you can offer here at BayCare?
Yeah, exactly. So typically when we refer to regenerative medicine, we're describing or referring to a treatment that involves either an injection of a blood product or a, quote, cell-based therapy. And there's a variety of these that are out there on the internet and on TV that people hear about. Most commonly, we are describing what the treatments that are involving what's called a platelet-rich plasma or a plasma injection, which we can talk more about. There's other areas that we can harvest these cell-based therapies, including bone marrow from the patient's pelvis, various regions of adipose harvest from a patient's body. There are some folks that are probably familiar with or have heard about placental tissue type products out there as well. So collectively, those would be referred to as regenerative medicine procedures, and there's pros and cons to each of them. Typically, the ones that we would offer here really revolve around the platelet-rich plasma and or the bone marrow aspirate concentrate procedures.
Yeah, so let's break those down a little bit. When you're talking about, let's start with PRP or platelet-rich plasma, what is actually happening in that procedure and what are you doing?
Yeah, great question. So regarding PRP, what we're essentially trying to do is harness the power of the platelet. So in everybody right now, there's billions of platelets floating around your blood, and these platelets contain a variety of growth factors and chemical signals that the body uses naturally to respond to injury. So for example, if you cut your finger and your finger starts to bleed, right, the platelets are the first things typically that rush to that area, clot the blood, release all these chemical signals that tell the body, hey, I'm hurt, and again, release the growth factors that allows the body to respond to begin the initiation of the healing process. And so we try to harness that. Basically, what a PRP injection involves is drawing the patient's blood, putting it into a special machine that allows the blood to be processed, which then concentrates the platelets to a very high degree, much higher than typically seen in the blood levels. After which, under ultrasound guidance, then we're able to deliver these platelets directly to the area of injury, thereby delivering these growth factors that occur naturally to a much higher concentration directly in the area of injury, and then allowing that process of healing and anti-inflammation to start.
Interesting, and we're going to get into a little bit about the science behind that in a moment. But I want to talk about BMAC, or the bone marrow aspirate concentrate. How is that one different, and what are you doing in that procedure?
Good question. So again, same idea of using the patient's own materials to improve pain and function and simulate repair. However, this would be classified as a, quote, true cell-based therapy, meaning there are live cells being used that come from the patient's own body. In this case, it involves drawing cells from the bone marrow out of the pelvis. And so what this involves is making two little small incisions in the back of the pelvis. We do have a little special tool that we use to kind of core into the back of the pelvis to access the bone marrow in the pelvic cavity. Drawing that out, then we put that back into the machine. The machine then processes it, again, concentrates the cellular layer, which we then isolate, and again, under ultrasound guidance, put back into an area of injury, whether it's a joint, a tendon, or ligament, and thereby allowing the cells to kind of do their work and initiate the responses that we're looking for.
Yeah, and I definitely wanted to bring that up because a lot of people, when they hear about regenerative medicine, they automatically assume it involves stem cells or those live cells that you're talking about. That's not true for all of the procedures, but it is true in this case, correct?
Correct.
Can you talk a little bit more about how that works?
Yes. So again, when these cells, they are live cells, and they do have, the ability to release a variety of chemical signals and instructions depending on the environment that they're placed in. So initially, when these cells were used for treatments, it was thought that because these cells have this pluripotent potential, they may be able to actually divide, regrow, and replace, for example, cartilage in an injured knee from arthritis, for example. As we learn more about these cells, however, what we're learning more is these cells exhibit their effects not necessarily by the division and the replication and replacement, although there's potential for that, but more by the chemical signals that they release. And so both the platelets and the cells contain a variety of growth factors, again, and these chemical signals that modulate the environment that they're in. And depending on that environment, they can have different effects. So for example, the platelets, we have studies that show if these platelets are placed into a degenerative injury state, such as a chronic tendon injury, like a rotator cuff injury. These injuries are basically injuries that failed to heal initially. They're kind of stuck in this degenerative state and never got past that point to heal. And so what we have found is that if we can restart that healing process, basically give the body instruction to start over and give it the growth factors that it needs, we've seen the ability to kind of allow these tendons to go through their natural healing response, which they failed to do previously. And so through either the platelet or the cell mechanisms, we're able to accomplish that. Now, on the flip side, in these acute injuries where you kind of, I would use tendonitis, for example, there's active inflammation. These cells and these platelets have the ability to not initiate inflammation, but to dampen it, to provide anti-inflammatory properties. And so again, that allows us to use these injections either for new or old injuries. Basically what we're seeing is kind of two large cascades of chemical signals that these products release. One is that very strong anti-inflammatory or pro-inflammatory signal, and the other that are these growth factors and proteins that allow for joint modulation, for example, or protein inhibition, components of these injuries that allow these injuries to kind of continue to brew, smolder, and progress. And so we're seeing kind of a two-pronged attack from these procedures that allow us to, again, improve pain and function in patients with conditions that would respond to these.
Very interesting. I think that's really great information. I do want to remind everyone, if you're just joining us, I'm here with Dr. Ryan Woods, a fellowship-trained non-operative sports medicine physician with orthopedics and sports medicine BayCare Clinic. If you do have questions about regenerative medicine or what treatment options are available, you can ask Dr. Woods directly in the comments below. This can be a very complicated subject, so we want to make sure that we're answering the questions that you have. Please feel free to ask those in the comments below, and we'll do our best to answer those today in real time. And so moving on, we've talked a little bit about these specific procedures. I want to talk about the treatment options that you can provide, or the treatment, the types of pain or injuries that you can maybe use these or utilize these treatments on. What can you do for patients as far as, is it acute, chronic, that type of thing? And I know you've discussed it slightly, but let's go into depth about that.
Yeah, like we talked about, the nice thing about these is they offer a minimally invasive way to treat the variety of acute and chronic. Typically, the most common conditions that we treat are arthritis. The majority of the literature and research out there is on arthritis, particularly knee arthritis being the most common, but certainly these procedures, either the platelets or the cells, can be used to treat a variety of joint arthritis, and we have performed that and have had success with that. Not just the big joints, such as the knees, the hips, the shoulders, but certainly kind of the more peripheral, wrist, elbow, fingers, ankles, toes, things of that nature. And so arthritis is probably one of the most common things that we treat. Now, on the flip side, the soft tissue injuries, we're seeing a lot of building evidence for, and clinically in our own experience, a lot of success with. And this would be our either acute or chronic tendon injuries typically. And so, whether that's from a work-related injury or a sport-related injury or a hobby-related injury, new or old, these treatments have been able to deliver improvements in pain and function. And again, most commonly, these would include things like a rotator cuff injury. Certainly a variety of conditions can allow for these treatments, but there are some conditions where these won't. For example, a full thickness rotator cuff tear with a high degree of separation, that's a surgical indication. But these kind of chronic partial or acute partial tears, where you have, a large majority, potentially even a small majority of the tendon injured, are potentially great candidates for these, where we can attempt to kind of scar in that tendon and potentially avoid a surgical procedure. Now, again, these injections, I'll echo, are not necessarily always a replacement. The goal is not to replace surgery, but for the right candidates, these can be great options. And we are very selective in who we offer these for, because we do want to give the patients the best opportunity to have success and respond to these injections. So from a tendon standpoint, rotator cuffs are things that we typically will treat. Chronic tennis elbow is another a very common condition that we will treat with these. Certainly proximal hamstring tendon origins. We have treated some distal hamstring tendon origins. Achilles tendonitis or tendinosis is another common one. Plantar fasciitis, something that can plague people for a long period of time. And so those, are conditions that are potentially candidates for these types of procedures.
Yeah, and you just touched on it a little bit, because I know that there are types of injuries or types of conditions where this isn't a good treatment. If someone's maybe suffering from, say, back pain or something like that, can you talk about the ones that maybe you wouldn't recommend these types of treatments for?
Yeah, again, like we touched on, this is a semi-new area of medicine. And so, the problem with science is it takes time and money. And so these studies do take a while to be performed. And so as far as the spine literature goes, these studies are not as tested within that spine literature, within those spine conditions as much as they're in the peripheral kind of joint world, the peripheral soft tissue world. Now, there are people experimenting with these, and those studies are coming, but predominantly the literature is in the peripheral joints, again, like I mentioned, the knees, and the other soft tissue related tendon ligamentous injuries.
Absolutely. So I want to talk about, maybe from a patient standpoint, if I am a patient or somebody who's maybe suffering from some chronic pain, maybe in my elbow or my shoulder, those kinds of things, what does this process look like, and what are you evaluating with them to determine, if regenerative medicine is going to work, and then maybe which treatment option is the best?
Great question. So with every patient, this is a very much an individualized approach. So we do start by taking a good history. We review physical exam findings, review any previous treatments that may have been performed, review any advanced imaging, or perform our own advanced imaging, basically to ensure that we're dealing with a condition that would be responsive to this type of procedure. So we really want to nail the diagnosis down first. Now, after we do that, we again start with the most conservative treatment options. If the patient has already attempted conservative treatment options, this would be something that may be brought up. And again, we are very clear with folks as far as expectations and predictions, again, depending on what we're dealing with. And if, in fact, these injections are not, the most optimal treatment, we would then either initiate, perform, or refer on to get that patient the most optimal treatment. But certainly this is in the repertoire. This is in the treatment bag of folks looking for maybe more of a invasive procedure, but not quite a surgical procedure, right? And for those patients who maybe have failed the traditional kind of conservative options of, rest, over-the-counter medications, physical therapy, splinting, bracing, things of that nature, or maybe have failed cortisone injections in the past, these are options where, depending on the right condition, may be offered.
Yeah, absolutely. And Obviously you had already mentioned that this is sort of a case-by-case basis and it's very individualized, but do you see people needing more than one treatment? Is this a series of treatments, or do you see this more as just a one and done and kind of go from there?
That is a fantastic question, and it really comes down to what we're treating, right? So, for example, arthritis, we know it's a chronic degenerative type of an injury or condition. And so, these treatments do have the ability to kind of improve not only the pain, but, potentially allow for some joint protection, cartilage protection, perhaps some disease modifying, disease slowing potential. But certainly at this day and age, even with these, quote, cell-based injections, arthritis is still very much a one-way street. So depending on the degree of arthritis, certainly these injections may have to be repeatable. And then often we tell folks that, again, we're not going to reverse arthritis with these injections, but it is a means to kind of modulate that joint, maybe allow for some disease slowing. So for cases of advanced arthritis, yes, typically this may involve a repeat injection. That time course is very variable. It really depends on how the patient responds and how long this benefit lasts for. It makes sense that, catching these types of conditions earlier does allow for probably a more robust response, and probably has increased longevity, right? So greater improvements, pain lasting for longer, than opposed to somebody who may be nearing the end stage of arthritis. And that's the conversation we have with folks, again, to ensure we are providing the best treatment options. Now, on the flip side, some of these soft tissue tendon injuries, in our clinical experience, we've had the one and done type of injections, where if we can initiate that repair response to get, let's say, a tendon to kind of scar back in from a partial injury and rehab them appropriately, if that tendon remodels to a high enough degree, the pain and function may be at a level then where it's either resolved or at least at the point where the patient's able to be functional, doing the things they want to do. And in that case, that's a win. It may not require then an additional injection. Certainly, if they're always at an increased risk of re-rupture, and if that happens, then again, we could start that process over. But it really is dependent on the injury. Now, there's some literature out there that is testing kind of the series of injections, and there may be a few studies that kind of lean that way. But at this point, it really is condition specific and response specific to each patient.
Very interesting. I want to get into just a little bit of the science of this, because when you say, you inject it right at the site of the injury, a lot of people are probably wondering how that's even possible. How can you do that? And I know you have some pretty incredible technology just as far as ultrasound and those kind of things. Can you talk about the actual process and what you do during these procedures?
Yeah, absolutely. So not only is this regenerative medicine topic exciting within the field of orthopedics, but really ultrasound technology has come a long, long way. And with today's ultrasound machines, we're able to see a lot more than we were before. And so not only is that very valuable in diagnosing orthopedic conditions, but it does allow us to get very specific in guiding needles right to areas of injury. Like I mentioned, for example, into an exact tendon tear, or making sure that we're in the joint that has the arthritis or meniscus injury, et cetera. And so there is a great specificity with these injections. We do want these injections to get into the right place, because per their biologic mechanisms, we need them to be in the right place. So as far as the procedure and how they work, for the platelet-rich plasma injection, it's basically a blood draw, simple blood draw, taking less blood typically than what you would donate if you were to go donate blood. Like I said, the machine takes a little bit of time to process that. Now, if we're dealing with a joint issue, it's simply finding, marking off the joint in question, and then guiding a needle directly into that joint space, again, depending on where we're going. The tendon injuries are a little bit different in that, like I mentioned, we have two subtypes of tendon injuries, new or old. The new ones, we basically want to kind of quiet them down, initiate that kind of anti-inflammatory response and jumpstart that repair process. The old, like I mentioned, are actually a failed healing response to begin with. And so we want to jumpstart a new healing response. And so we actually create a kind of a micro-controlled new injury, where we can actually perform what's called like a needle tenotomy procedure, where we basically kind of break up the old tendon scar tissue and create channels to place these products within the diseased tendon. And so we kind of create a new localized injury to kind of initiate a response that tells the body, hey, I'm hurt, we need to come fix me. And then in that process, we deliver these growth factors and proteins that the body would use naturally to a much greater degree at the site of injury, again, to kind of jumpstart a new repair process. So depending on what we're doing, they can be a little more or less involved. All of our procedures are done with ultrasound guidance, so to ensure we're in the correct location.
Yeah, and it's pretty incredible to see. And I know we have some things planned for you in the future to kind of showcase some of that technology and what that actually looks like for patients as well. So what does it look like from a patient standpoint as far as inpatient, outpatient? Can they leave right away when they're finished? What is that like?
Great question. So all these procedures are outpatient, typically ranging anywhere from 1 to 2 hours, depending on what we're doing and where we're doing it. Patients are awake the entire time. Again, if we're doing more of a cell-based procedure where there's a bone marrow harvest involved, we do offer a little bit of medication at times to kind of take the edge off, but certainly patients are awake the whole time, so they do go home the same day. Typically, we want patients to bring a driver, right, because following any procedure, there is a little bit of soreness, potentially and some discomfort. However, it is very minimal at best. Most folks are able to get by with Tylenol or ice after the procedure. We do typically offer slings, braces, canes, crutches, walkers, again, depending on where we're going to help offload these areas that we're treating. Because again, by their mechanism, depending what we're treating, these procedures can induce inflammation short term. And so it does give these body regions an attempt to kind of rest while that process starts. As far as the process thereafter, being a very big proponent of rehab and physical therapy, there is a required portion of this where we do involve our therapists, and we have various rehab protocols depending on what we're treating. And so after these procedures, we have a short follow-up period at about a few weeks after, just to make sure there's no complications, after which we initiate physical therapy, and that can range anywhere from 4 to 8 weeks, depending on injury treated and the response thereafter. One thing to note about these injections is it's not like a typical cortisone injection. If patients have had those before, they can sometimes experience kind of immediate relief. These injections do take a little bit of time to set in based on their mechanisms. And so, it's not an overnight fix. Rather, it's more of a process that does involve a rehabilitation phase. So that's important to note.
Yeah, and you segued perfectly into it, because I wanted to talk a little bit about how that's coupled with therapy and how that can affect possibly the need for additional treatments, those kinds of things. So therapy is an important aspect in some cases. Absolutely.
And really, most important probably when it comes to tendon healing after one of these procedures. Now, tendons are really good at their job. They're basically a rope, right? But they're a dumb rope. So they need to be told how to pull, when to pull, where to pull, what length to pull at, and what loads to be able to handle. And so what happens is if you have a tendon injury that doesn't rehab properly, you basically get a bunch of disorganized scar tissue that continues to make that tendon a little less functional, which can predispose you to, again, recurrent tears or smoldering pain. And so as we're jumpstarting this new process, it's very important that the tendon get educated, knowing which way it has to distribute its load in order to heal and lay down the new scar tendon properly. As far as joints go, it's similar in that, every joint has to bear a load. With every step, there's a force going through, for example, our knee joint. So between our knee and our hip joints, every pound of body weight you carry translates to roughly 4 to 6 pounds through those joints with every step. And those joints need a little bit of protection too. And our muscles are the best braces that we'll ever own. And so, life gets busy, these muscles get deconditioned, but the forces don't change to those joints. So if the muscles are not there to brace them, those joints repeatedly have to kind of bear these forces, which again, over time causes that wear down. And so the therapy is important to get those muscles around these joints strong, balanced, and conditioned to stabilize those joints, which then helps offload the forces of those joints and can, again, improve the pain and function around that joint. So therapy by far is extremely, maybe even one of the most important features of this kind of regenerative medicine treatment arm.
Fantastic. I want to talk about results, and I know that you've seen some pretty impressive results from patients that you've treated. Can you talk about what you've seen as far as in your patients or what people can expect?
Yeah, and it's a great question. It's a little bit of a tough question to answer because, again, every injury is different.
Right.
Every joint's different, every tendon's different, and all the data that we have available, it does kind of span across a variety of conditions. Typically, the knee arthritis is the one we pull a lot of data from. So with all the data pooled, you can ballpark roughly 70% of people having a response to these procedures. That does mean roughly 30% of patients will not have any response or improvement from these injections. And that's where we try to be very selective, again, in who we do this for in order to kind of increase that number or increase that response rate. And so I would say clinically, we're that or better as far as response rate. The degree of response rate varies again. Some studies will quote 40 to 80% in improvement in pain. And again, depending on the condition, there's a time length to that, or again, maybe a one and done. Certainly we've been on both ends of that spectrum, meaning we've had failures, right? But we've also had great success where pain is completely resolved. And so, I think our honest approach as far as nailing down the diagnosis and discussing all available treatment options and giving patients an honest expectation of whether we think these treatments would be beneficial does improve our response rate for these various types of procedures.
Absolutely. So if I am a patient, again, who's interested in learning more about orthobiologics, what's my course of action? What should I do?
So certainly if you have a primary care provider, they're able to refer directly to us, but a referral is not required. Certainly you can jump on our website and look for our contact information and schedule an appointment yourself, at which point we can again review any documentation or treatments you've had to date, and again ensure that we're treating the right condition, at which point we can talk into a little bit of a greater detail about what treatment options might be available, specifically regenerative medicine treatments.
Absolutely. This is excellent information. Is there anything else that you want to add, Dr. Woods?
I would just probably stress that these are very exciting and new treatment options. There's a lot of good and bad information out there regarding these treatment options. And so for patients who are thinking of pursuing these options, I would encourage patients to ask the tough questions and really be sure what you're receiving if you are to undergo any of these procedures. Because it is your body, you know it better than us, and you should know what's being done to it going forward. And so I would stress just getting educated. And again, we're always happy just to answer questions as needed as well.
Absolutely. And it starts with that conversation, as you mentioned. There is a consultation period beforehand. You're going to talk to them, kind of personalize this approach to their specific injury or case.
Absolutely.
Well, thank you so much for taking some time with us today. I really appreciate it. I think our viewers did too. Thank you all for joining us. To be alerted about our live content, be sure to like BayCare Clinic on Facebook and click on the bell icon below to subscribe. Again, Dr. Ryan Woods is a fellowship-trained non-operative sports medicine physician with Orthopedics and Sports Medicine BayCare Clinic. If you have additional questions, please feel free to ask them in the comments below. We'll go ahead and answer those or continue to answer those online after the live broadcast. And if you want to learn more about Orthopedic and Sports Medicine BayCare Clinic or request an appointment, visit baycare.net. Thank you and have a great day.